Hello and welcome. My name is Dr. Grace Kakari. I go by Dr. G, and I am with the University of North Dakota School of Medicine and Health Sciences. And meet my co host.
Yeah, hi, I am Dr. Grayson Zhao, and I am with the North Dakota Department of Health and Human Services.
We would like to welcome you to Dakota Wellness Chats. We are going to have some awesome conversations related to health and wellness. And today we are talking about women's health, and we have a guest with us. Please stay tuned. And then we are very excited to be having this conversation with Kim. Kim will introduce herself in a second, but this is the month of May, so we are paying some attention to women's health. So, Kim, could you please introduce yourself and then we'll move on into the conversation?
Hi, everybody. Thank you for having me. My name is Kimberly Ruby, and I am the Title V Maternal and Child Health Director for the state of North Dakota, and I work in the Department of Health and Human Services.
That's wonderful. Thank you, Kim. Maybe we should start off by clarifying what Title V is. I think we've had Title IX, we've had different numbers out there. What is Title V, please?
Right. Title V stands for Title V of the Social Security Act, which basically means maternal and child health funding. So we're operated through a federal block grant program, and the Title V funding is the source of funding that supports promotion of women's and children's program to promote health and well-being for mothers and children, their families, including children with special healthcare needs.
Awesome. Thanks, Kim. And so, with May having the National Women's Health Preventative Week, I am curious. So, one of a few things that we know about North Dakota is about 1 in 5 women struggle with some form of depressive disorder. We also know that about 1 in 10 women in North Dakota are smokers, current smokers, and about 1 in 10 are diabetics. And so when you think about some of these lifelong conditions or some of these risk behaviors slash outcomes, what is Title V doing to address these issues?
Right. Every 5 years, Life establishes priorities within each one of our major health domains. One of those major health domains would be women's health. And with women's health, one of the things that we wanted to promote was really promotion of preventative well visits so that we can catch all of those things that they're struggling with early, make sure that they have access to care and access to providers. So within those preventative health visits, we're really hoping that they're having their annual women's check for reproductive issues, or making sure that lab work is correct and up to date, and that they're just taking care of their health. And so really smoking, prediabetes, reproductive things, anything that a woman really should be addressing should be done within that preventative health visit.
That's amazing. So we know that you released this report not too long ago. 2022, a year ago. So, what are some of the key things we should focus on as we continue to talk about women's health?
Right. This report is really talking about how we've incorporated health equity within Title V. When we talk about health equity, we want to ensure that all mothers and their families have access to care. And one of the things that we have done was we actually established a health equity office. That office started out as a team of one person who was really going to focus on our maternal and child health work efforts. Upon hiring that person, we realized that this was a lot greater than just maternal and child health. It really should be a department-wide initiative. And so over the last couple of years, we've really grown that office. We now have an entire community engagement office with Chrissy, our health equity director, at the forefront. And then now she has really grown into a team of about 12 people. So what we've started with one, we've grown into 12, and we're really able to focus, as you can see, on a variety of things that might be impacting the health of North Dakota in general, including women and children.
Excellent. Thanks, Kimberly. And it's actually quite nice to see that expansion of into the tribal population, but then also the new American foreign-born and immigrant population, because again, we know that's a really growing population. I guess one of my other questions would be around women who are low income, because we do know that's a population that really struggles in getting access to services. What are some of the new things that the Department of Health and Human Services is doing around this?
Yes, that's a great question. And one of the most exciting initiatives that we have been working on is expansion of Medicaid within the postpartum timeframe for women. Previously, women could only receive Medicaid under the postpartum category for 60 days post-delivery. Upon working with our Department of Human Service staff and other key partners within Title V, we have been able to successfully expand that to include 12 months postpartum, so that the woman can not only access care for the baby after delivery, but make sure that her overall health needs are addressed as well. We want to make sure that if she has any physical or mental health concerns after baby is born, that she doesn't fall off of having healthcare coverage and can access her physician without that financial difficulty.
Thank you so much, Kim. So we've seen a decline in preventative doctor visit. From your experience, what can you share with us, and how can we encourage women listening to us today to visit their doctors?
I would say the biggest thing that we could probably endorse is just letting them know that there are resources available. In addition to Title V, we have been partnering closely with the family planning clinics throughout the state of North Dakota who operate on a sliding fee scale. Like I had mentioned before, we've worked on improving Medicaid access to care for women, and we're also working with other third-party payers to make sure that this is something that's on their radar screen and that we're paying closer attention to preventative health rather than fixing the problem once it's been identified.
That is excellent. I am super impressed by all the work that you and your team are doing, and I'm so excited, especially on that postpartum expansion coverage. I think that's going to make such a huge difference to families and women in North Dakota. And I believe that's it for my question, Dr. G, unless you had anything else. But I'm just so grateful that you're our first guest because you really know this stuff for real.
Oh, yes, we are very grateful that you were able to make time to be with us today. I think we are doing well as a state, but we still have a long way to go. And we would like to encourage everybody listening to us to please visit your doctor, take care of yourself, get your stuff checked. So if you have any final lessons or final words you want to share with us, we'd be grateful for that, Kim.
No, just thank you so much for having me. And as Dr. G said, I hope that every woman who's listening to this today feels confident in making that appointment for their annual well visit.
Awesome. Thank you so much for joining.
Thank you for having me.
Thank you.